हाय सो वेलकम बैक टू द यूट्यूब चैनल। सो आज हम जनरल पैथोलॉजी के फ्यू कॉन्सेप्ट्स को सीखेंगे। So when you talk about general pathology or pathology in general, there are four aspects of every disease and which makes the core of pathology. So first you will discuss about the etiology, which is the cause, क्यों हो रहा है. Next, the biochemical or the molecular mechanisms behind the cause, which is usually termed as the pathogenesis. And then you have the associated structural changes, which is the morphological changes. And because of all of this, there will be functional alteration in the tissue, which is commonly seen as the clinical features. So whenever you describe a pathology of a disease, these are the main four headings that you should describe it under: the cause, the pathogenesis, the morphology and the clinical features because of all of these morphological features. So coming to the topic per se today, first these are 7 questions that I want you to answer. So if you can answer all of these questions, maybe this video is not meant for you, but these are a lot of repeated NEET and INI questions, which are a few concepts which are usually tested in these exams. And also if you are a first year pathology resident, these are a few questions that during the autopsy postings or during your first month or first 3 months, they usually tend to ask these questions. So it will be useful for your reporting and for your knowledge in general. So we will answer these questions in the subsequent video and you will understand all about this, at least a gist of it. So coming to the cell injury, which is what the topic we will be discussing today. So if someone asks you, is cell injury reversible or irreversible? Your answer should be, it is reversible, but एक certain point के बाद when the biochemical changes or there is a threshold after which the cell cannot revert back to its normal physiology, and that is when irreversible cellular injury comes to picture. So imagine any cell which is normally functioning in the body, when it has a stress, so what happens? Usually it's like for us human beings also, when there is a stress we try to adapt to it, but when we cannot adapt, a cell is also like that. When you cannot adapt, what happens? Cell injury occurs. Okay, there will be cell injury, and when cell injury is long term, severe and progressive, what happens? It becomes irreversible cell injury. And there are the most two patterns of injury, which is necrosis and apoptosis. Necrosis we will be discussing in this video, and apoptosis is a bigger topic, so we will discuss it in the next video. So these are the stages of cellular response. So a cell with a stress which is reversible can go for a cellular adaptation in form of hyperplasia, metaplasia and others, atrophy. But when there is a cell injury which is progressive, the cell goes into irreversible cell injury. Okay. But when does a cell goes to reversible cell injury? When the injury is only mild or transient. थोड़े दिनों के बाद अगर stress चला जाएगा तो you can always get back, the cell can always get back to its normal function. Okay. So what is the answer to our first question? Is cell injury reversible? Yes, but only up to a certain point. Okay. So what are the common causes of cell injury? The first common cause is hypoxia, decreased oxygen supply to the tissues. Then a cell can undergo trauma. Okay, and trauma can be in form of injury or other temperature changes. So there can be increased temperature or decreased cold temperature and anything, chemicals such as poison, carbon monoxide, arsenic and others. Then you can have infection. Okay, so infection can be bacterial, fungal and viral, so any form of infection. Then genetics. So genetic diseases can also cause reversible or irreversible cell injury. And then you have nutritional imbalance. So diseases such as anorexia nervosa, all of this causes cellular injury. So now you know just a basic of what cell injury is, what is reversible and irreversible cell injury. So coming to the topic per se. Okay, so we have already discussed reversible, irreversible ka type. So Initially when a cell has a stress, what happens? Like any person, okay, so a person was probably working normally and then a stress comes to into his life. So क्या होगा? उसका functionality decrease होगा. So that happens to our cell also, right? So first what will happen after, when the effect of the injury, as the time passes, first there will be decrease in cell function. So till there is a decrease in cell function, this is reversible. Okay, reversible cell injury. But after that, first you will see biochemical changes. Okay. So, the biochemistry of the tissue or the cell gets altered. After that, what happens? You will have ultrastructural changes. So, what do you mean by ultrastructure? Though subcellular levels में changes होंगे. Ultrastructural changes usually you see in electron microscopy, not in light microscopy, which you see in your pathology labs. Then you have light microscopy, which you usually see routinely in path labs and also in your classes. And next, finally, you can see it grossly. So, if you get a liver cirrhotic liver, you see that grossly उसमें बहुत सारे nodules दिखते हैं, rough surface होता है. So, that is the gross morphological changes, and that is usually the last change that happens in the tissue. So, first क्या होगा? Reversible cell injury जब शुरू होगा, cell का function decrease होगा. Cell के function decrease होने के बाद, if your stress is removed, your cell will go back. Okay, so that is reversible. But अगर वो stress नहीं जाता है तो आपका cell will progress to biochemical changes, followed by ultrastructural changes, followed by light microscopical changes, which you see on the microscope. Okay, that we usually use, and then finally light microscopy के बाद gross morphological changes दिखने लग जाते हैं. ठीक है. So that is the sequence of effect and duration of cell injury. So coming to the topic first we'll discuss the features of reversible cell injury, so that it will be easier for you to remember what is the difference in irreversible cell injury. So in any type of injury, what is the first manifestation that you see? Okay, there will be cellular swelling. Okay, and there is why. If I ask why cellular swelling will happen, it is due to the loss of function of ATP dependent sodium potassium plasma membrane pump. Okay, loss of ATP dependent sodium potassium plasma membrane pump. So when there is a loss of function of this pump, what will happen? Water will get inside the cell. So there will be water influx. So if water gets into the cell, what will happen? The size will increase, cellular swelling will happen, and also this is known as hydropic change. Okay. So this is the first manifestation of any injury, be it reversible, irreversible. After that क्या होगा? There will be clear vacuoles in the cell. So these clear vacuoles are pinched off segments from the ER, and this is known as vacuolar degeneration. Okay. So that is another thing, vacuolar degeneration. Okay. So these are the two most common changes. Then now according to the cell structure, we'll discuss the changes. So first cell में क्या आएगा? Plasma membrane आएगा. So plasma membrane में what do you see? You will see blebbing, blunting, and loss of microvilli. Okay. Next you have, of course, your mitochondria. So in mitochondria, what you will have? This will also swell up, and then there will be presence of amorphous densities. Okay. In your cytosol, which is cytoplasm, what will happen? There will be myelin figures. So if anyone in your reporting or in any question they ask you what is myelin figures, you have to remember that it is phospholipids of degenerated cell membrane. Okay. So its component is phospholipid है, ठीक है. Then ER, which is endoplasmic reticulum, also gets dilated, and nucleus may also fragmentation, disintegration, everything happens. Okay. So these are the common features of reversible cell injury. Now coming to irreversible cell injury, if you remember this image, it will be easy to remember. Okay. So grossly आपको इस image में क्या दिख रहा है? Necrosis और apoptosis. Okay. तो necrosis में क्या देख रहे हैं? Cell का size पहले देखिए. Cell का size is enlarged in necrosis, whereas in apoptosis the cell size is decreased. Okay. Now we'll come to the plasma membrane. So how does the plasma membrane look like in necrosis? See, it looks disrupted. Okay. So there is disruption of plasma membrane in necrosis, but if you see the cell membrane here, it's quite intact, right? So that is the difference. Plasma membrane is intact in apoptosis. Now how does the nucleus appear here? So the nucleus will have pycnosis, karyorrhexis and karyolysis, but nucleus in apoptosis will have fragmentation. Okay, that's why two fragments are here. So this is the nucleus. Coming to inflammation, so when there is a plasma disruption, the leakage of lysosomal enzymes, what will happen? Surrounding area will get inflamed. Okay, so there will be inflammation in necrosis, whereas in apoptosis it is not associated with inflammation. Okay. Inflammation is absent. Now if I ask you, in our body do we see necrosis very frequently? So the answer should be no. So necrosis is purely a pathological process, but apoptosis can be physio or pathological. Okay. So normally your cell will not show necrosis, it will usually show apoptosis if it has to undergo cell death. So now you know the concepts of reversible and irreversible cell injury. Now we will discuss a few points about necrosis. So I told you that the nuclear features में क्या क्या होता है? Karyolysis, pycnosis and karyorexis. So these words are quite important for you to remember. Okay. So first is karyolysis. So what happens? There will be decreased basophilia and यहाँ क्या होगा? DNA loss होगा, because of which there will be action of endonuclease and that will cause DNA loss here. Okay. Other than that, what will happen? There will be pycnosis. So what is pycnosis? It is shrinkage. Okay, it is nuclear shrinkage and decrease in basophilia. And what will happen to the chromatin? It will get shrunken, dense and it condenses. Okay, so in pycnosis it becomes smaller. Karyolysis में क्या होगा? Lysis में क्या होगा? Decreased basophilia. And karyorexis में finally क्या होगा? Fragmentation. Okay, so it's karyolysis, pycnosis and karyorexis. Okay, so what are the two phenomena that characterize irreversibility? So you have to remember that irreversibility एक cell में कब आएगा? Because of two features. One, you remember about the mitochondria. Okay, so mitochondrial dysfunction will cause irreversibility. So इसमें क्या होगा? There will be no oxidative phosphorylation, and when there is no oxidative phosphorylation there will be no ATP. Second one is your membrane. So there is membrane function disturbance. Okay, so these two are the 2 points or the two phenomena that characterized irreversibility. So I told you, right, so necrosis में nuclear changes होंगे and necrosis is also associated with denaturation of cell proteins. और इसमें क्या होगा? Cellular elements will leak into the surrounding area and cause inflammation. तो इसका सबसे जब necrosis का associated proteins, that intracellular proteins due to necrosis come into the bloodstream, they can be used as diagnostic markers. Okay, one of the example is troponin. So you know, post MI cardiac myocytes, okay, they'll release troponin, because of which, and this is due to the necrosis of the cardiac myocytes. So this can be clinically tested, and that is when we will say the patient has an episode of MI or not. Another example is in bile duct. Okay, so in bile duct epithelium, when they get necrotic, they produce ALP. Another example of again a necrosis associated leakage of intracellular protein is transaminases. Okay, so transaminases are released when there is a hepatocyte injury. Okay, so these necrosis associated cellular proteins can be used as diagnostic investigations. We can use it in lab and try to see if the patient has that disease or not. Okay, so that is the point of necrosis, and we've always also discussed the phenomena which characterized irreversibility. Now coming to the patterns of cell necrosis. Okay, so this is quite important. Here you have to remember a few things. So पहला वाला है, grossly if I tell you what is this shape. Okay, this is a wedge shaped. Okay, I'll tell you the significance of this later, but now if I tell you the architecture of the tissue is maintained, okay, and the affected tissue has a firm architecture, it's still firm, okay, and this is due to enzymes and proteins, but there is no proteolysis of dead cells. So over a period of few days and weeks there will be inhibition of proteolysis of dead cells, because of which cells maintain their firm architecture. जो टिश्यू होता है उतनी जल्दी नेक्रोटिक नहीं हो जाता है. ठीक है. So if you see something like that, you will write coagulative necrosis. So in coagulative necrosis, you have to remember that this is due to a form of ischemia. Okay, so there is ischemic injury, and because of this what happens, there is loss of blood vessel, right, loss of vascular supply. So the wedge shape is because यहाँ पे जो apex है यहाँ पे है blood vessel, and it is a wedge shape because there are branching blood vessels from here, okay, which gives it a wedge shaped infarct. So this is known as an infarct. It's due to an ischemic injury due to a blood vessel obstruction. Is usually seen in all solid organs such as kidney, heart and everything. Okay, so again on microscopy, how do you see necrosis? Okay, so necrosis usually looks intensely eosinophilic. Eosinophilic matlab pink. Okay, so if you see, these round structures are all the nucleus, and if you see here, our nucleus is completely absent. Okay, and there is a clear line of demarcation. So this is the viable tissue and this is the necrotic tissue. So the ischemic injury which causes firm architecture grossly in the tissues of wedge shaped infarct and delayed proteolysis of the cells is coagulative necrosis, and it is usually seen in most of the organs. Okay, but an exception is there. This, can anyone tell me what is this tissue? Yes, it has sulcus and gyrus. Sulci and gyri are seen in brain, right? So an exception to this rule where the proteolysis of dead cells happens, but there is enzymatic degradation. Okay, so that is seen in liquefactive necrosis. So what does liquefactive necrosis में क्या होता है? Digestion of dead cells happen, okay, and then this forms a viscous liquid like material and further accumulation of leukocytes. So accumulation of leukocytes is known as pus. And why does this happen? It's because of hypoxic death of CNS. So microbes will stimulate accumulation of leukocytes and there will be enzymatic degradation, okay, destruction or degradation, and this is usually hypoxic death in the brain is known as liquefactive necrosis. Okay, how do you identify sulci and gyri? आप देखो, आपको पता है कि ये ब्रेन है, ब्रेन में अगर नेक्रोसिस का क्वेश्चन आएगा बिना देखे लिक्विफैक्टिव नेक्रोसिस को टिक मार देना है, ठीक है. नेक्स्ट, दिस इज वेरी फेमस. सो इफ आई आस्क यू व्हाट इज दिस टिश्यू, व्हाट विल यू से? सी देयर आर अ लॉट ऑफ ऐसे खाली खाली स्पेसेस हैं, and this looks like an apex. Okay, so this is a lung, and in lung if you see cheese like material which is granular, देखो granular है, dirty है, this is cheese like appearance, white appearance of necrosis, and there is granular debris. It is infamously known as caseous necrosis. Okay, so what happens here, there's a cheese like granular debris which on microscopy looks like an eosinophilic material with granular देखिए debris दिख रहा है. So this is caseous necrosis, followed by, it is surrounded by so many epithelioid cell histiocytes, and then you have Langhans type of giant cells. Okay, horseshoe shaped, ये तो foreign body है, but बाकी you will see Langhans type of giant cells. So when you see all of this, you know that this is the most common characteristic disease which shows caseous necrosis is tuberculosis in India, and it's very infamous. India is famous for tuberculosis, hence it has caseous necrosis. Okay, so you have to remember how do you define a granuloma. So I've made an extensive video on everything about granuloma and the pathogenesis. So the pathogenesis and mechanism of how a granuloma is formed, how macrophages get activated, all of this will be found in this video. Please check it out once, because granuloma is a question. It was an MD question also, and in UG also they ask this question multiple times, and tuberculosis is also a question. So if you get a question on granuloma, tuberculosis, you can just refer to that video and some parts of this and you'll be sorted. You don't have to read anything else. So that is sorts out our caseous necrosis. Okay, and then coming to the next, so we'll just summarize few granulomas, because I told you it's very important. At every stage granulomas are very important. So the first example is TB, which is caseating granulomas, it's very famous, and then leprosy. Okay, that is also non-caseating granuloma. But how do you differentiate between a granuloma of TB and leprosy? Okay, based on the cases, okay, but both of them will have acid fast bacilli. One will be positive in one concentration of H2SO4, but a lesser concentration is required for the leprae bacilli. Okay, then you have syphilis. So in syphilis also you will see granuloma because of Treponema pallidum, but what you see, there will be more plasma cells. Okay, there will be increased plasma cells. Again, next is a very important question, has come multiple times. What type of granulomas do you see in cat scratch disease? And you see stellate granulomas. Also another very famous question, what is the characteristic type of granuloma that you see in sarcoidosis? या फिर the non-caseating granulomas are most commonly seen. इसमें से एक ही question आता है, your answer should always be sarcoidosis. And next you can also have granulomas in Crohn's disease. If anyone asks you, can you see granulomas in Crohn's disease, you should say yes, and it will be occasional non-caseating granulomas. So this is usually for the UG students, all these granulomas, इससे ऊपर नहीं आता. But few points for PG students. So if you have to remember, at least you should make a list of all the tumors that are showing granuloma. So the most usually we see in routine practice, Hodgkin lymphoma is infamous for having granuloma. You can also see granuloma in seminoma. Okay, so those are two answers. You can make another list of everything. Coming to the next one, which is this. Can you identify grossly what is this? This is a foot, of course, lower limb. Because of decreased blood supply, it has gone into a gangrene. Okay, so if I say that there is an ischemic injury, blood supply band ho gaya hai, so what it is, it's a type of, what type of necrosis? We've already discussed it before. It's a type of coagulative necrosis. Okay, but when there is a bacterial infection, okay, when it is super added, so what will happen? There will be enzymatic degradation. So we know that enzymatic degradation happens in what type of necrosis? In liquefactive necrosis. Okay, so when there is bacterial infection, liquefactive necrosis, it is known as wet gangrene. So please remember it, gangrene is a type of coagulative necrosis. Next, coming to another. So if I ask you what is this tissue, और ये मैं क्या दिखा रही हूँ histomorphology में, this is a blood vessel. Okay, and why am I saying this is a blood vessel? I have again made a video on atherosclerosis. उसके जो first part है, first 10 minutes I think I'm teaching how to identify a normal artery, a normal vein. Please go there and refer it. It's a really good basic morphology का video है. So you'll understand why I'm telling this as a blood vessel. ठीक है, so ये blood vessel है, and how do you describe on light microscopy this structure? So you will say this is granular, right? Dark, densely eosinophilic, fibrillary, है ना? So this is fibrin like. ठीक है, so when there is vascular damage due to immune complex, so immune complex क्या होते हैं? Antigen antibody complexes. Because of that there will be deposition of pink amorphous material along the wall of the blood vessel. Okay, and the blood vessel का जो internal elastic lamina और सब होता है, there will be destruction of the blood vessel, and there will be pink amorphous material, and this type of necrosis is known as fibrinoid necrosis. This is usually seen in vasculitis and everything. So fibrinoid necrosis. Coming to another type of necrosis. So before that, let's again. So one thing you have to remember, pathology हमेशा आप अगर आप UG में हो, PG में हो, you should always make sure that even though you are seeing a डिसीज एरिया, अगर आप ट्यूमर देख रहे हो तो उसका एडजेसेंट पैरेन्काइमा नॉर्मल हमेशा देखना होता है, क्योंकि अनलेस यू नो व्हाट इज द नॉर्मल यू विल नेवर बी एबल टू नो व्हाट इज abnormal. Okay, so what is this structure? This is how normal adipocytes look like. Okay, they'll be completely clear and they have an eccentrically placed small nucleus here. Okay, so this is how adipocytes look like. But when I'm telling you that there is a history of patient who is a chronic alcoholic who drinks a lot of alcohol and comes to the ER with severe abdominal pain and vomiting, then you will suspect that the patient has acute pancreatitis. So in acute pancreatitis, the type of necrosis that we see is fat necrosis. Why does this happen? Because there will be activated pancreatic lipases. So what do? These will leak out of the cells and then they will liquefy the membranes. Okay, they will liquefy the membranes of these fat cells, and then there will be fat saponification. Along with fat saponification, so जो fibrous septa है, there will be fibrosis here. Okay, and there will be thickened, उनके वॉल सारा thickened हो जाएगा. And additionally you can also see calcium deposits. So how does calcium look like on microscopy? So calcium will look basophilic. So basophilic मतलब bluish, okay? They look intense basophilic. Sometimes they'll be granular and they can be refractile. So refractile मतलब एक प्लेन से दूसरे प्लेन तक नॉट बी इन द सेम प्लेन. ओके, आप अगर माइक्रोस्कोप का फाइन एडजस्ट करेंगे तो ऊपर भी दिखेगा, नीचे भी दिखेगा, क्लियर नहीं होगा. सो दैट इज रिफ्रैक्टाइल इन लेमैन्स वर्ड. एंड ग्रॉसली इफ यू सी अ पिक्चर लाइक दिस, जस्ट गो अहेड एंड राइट इट एज फैट नेक्रोसिस. So another example, a very common example of fat necrosis is that women, when they have a trauma to the breast, okay, so breast is also having a lot of fibroadipose tissue, right? So breast can also show fat necrosis. So when you see when they give a history like that, a woman had a trauma to the breast, and then they give you a morphology like this, please go ahead and write fat necrosis. Okay, so that's all that we require, at least for now. I think we've studied a lot of things. Now we'll just discuss a few questions. So the first one is, what is the telltale of free radical injury, and also it's a feature of wear and tear. Okay, so now I'll zoom it. So what can you see? You can see brown granular material. Okay, so and then what is the location? So this is the nucleus, this is the nucleoli, and then this is perinuclear. Okay, so this is perinuclear. So what are the brown pigments that you usually see? Usually you know that there is hemosiderin and lipofuscin. So why am I telling that this is lipofuscin and not hemosiderin? Is because hemosiderin is usually seen where there is a lot of hemorrhage. So old hemorrhage is when, and the granules यहाँ पे थोड़ा सा और fine है. Hemosiderin will be usually golden brown and coarse granules and is usually associated with old hemorrhages, and it will be seen in the macrophages. Okay, but the telltale of free radical injury, you have to remember, is lipofuscin. It has been asked multiple times and it's quite important, and it is also known as wear and tear pigment. Okay, so this is lipofuscin. Next question, which is not true regarding apoptosis? So we know that in apoptosis there is intact cell membrane. Yes, that is why there is no inflammation. Cytoplasmic vacuoles, definitely everything shows cytoplasmic vacuoles. Nuclear compaction, nuclear में degradation, nuclear compaction होता है कि नहीं होता है? होता है. And then you have cell swelling. So cellular swelling is usually seen in necrosis, whereas cell shrinkage is seen in apoptosis. Okay, is seen in apoptosis. Next, what is the first sign of injury? So first sign of injury we know that we discussed from the irreversible type में. First क्या होता है? There will be mitochondrial dysfunction, then only there will be membrane damage, and mitochondrial dysfunction will lead to loss of oxidative phosphorylation, which decreases the ATP. Next, blebs are usually seen in what type of injury? We learned that in plasma membrane there is blebbing, blunting and loss of microvilli, which is seen in reversible injury. Okay, so now another question is type of necrosis which is seen in blood vessel in vasculitis. So ऐसा भी नहीं हो सकता. You can get a clinical scenario where they say that a young male child presents with purpura, petechiae, and then he also has hematuria. So you know that this is a Henoch-Schönlein purpura, HSP, and in HSP you will have vasculitis, and then the patient. Vasculitis में क्या है? Fibrinoid necrosis is one of the defining morphological features of vasculitis. So these are the main 5 questions that usually get repeated. So we'll discuss the first, हमने जो first 7 questions देखे थे जिससे हमने वीडियो शुरू किया था. We'll just start with those questions. Definitely you'll be able to answer this, I suppose. So first question is, preservation of tissue architecture for a span of at least some days. तो इसमें क्या है? Tissue architecture is preserved. Okay, so what does it mean? That proteolysis has not yet set in. So it is usually is least likely. So what is the thing with all of these questions that you encounter in NEET and INI? So they usually write not true, likely to be, not likely to be. So आप ना हमेशा उसको एक बार मन में mental note डाल देना कि नॉट लाइकली है, नॉट ट्रू है, फॉल्स है, वैसे तो इसमें लिखा है नेक्रोसिस इज लीस्ट लाइकली, मतलब नहीं होना चाहिए इन. So first option is renal cortex. Of course not. We saw the renal only. The wedge-shaped infarct was in renal. Myocardium, no. Spleen, no. And then the next one is brain. So why am I saying it? The answer is brain? Because in brain you know that you have liquefactive necrosis. And what are we saying here? We are saying coagulative necrosis. Okay, they were defining coagulative necrosis here. So the answer is definitely the organ which shows liquefactive necrosis, which is brain. Next is enzymatic digestion dominates over protein denaturation. We have again learned that in liquefactive necrosis enzymatic digestion happens. So that is again your answer. Protein denaturation after a few days happens in coagulative necrosis. Next, loss of nuclei with persistence of cellular outlines is usually seen in. Loss of nuclei with persistence of cellular outlines किस में दिखता है? Is usually seen in apoptosis. Okay. Next, you have granulomas formed due to immune complex mediated mechanisms. So I've told that granuloma and TB, I've done an extensive video, so I've linked it here, please go and see. So granulomas due to immune complex mediated mechanism, the major player is interferon gamma. It's very important. This is what causes the activation of the macrophages. Next is deposition of immune complex and fibrin in the vessel wall is known as, it's given here, it's known as fibrinoid necrosis. Next, Langhans giant cells are characterized by, again I've made I think a video or a reel on the types of giant cells, which is very important. So Langhans type of giant cells, how do you define it? It looks like this. Okay, so there is a peripheral horseshoe shaped arrangement of nucleus, so that is the definition. But when there is a central clustering of nuclei, this is known as a two-tone giant cell, and when there is a random nuclear arrangement, that is defined as a foreign body giant cell. Okay. Next, granulomas without caseous necrosis is commonly seen in. So granuloma with caseous necrosis, tuberculosis, with fungal infection में भी बहुत ज़्यादा caseous necrosis दिखता है. In fact, बहुत ही irregular होता है. But we know that one defining disease where there will be granulomas without caseous necrosis is sarcoidosis. Okay, there will be discrete, small, well-defined granulomas in sarcoidosis. Please remember it. And Hodgkin lymphoma and seminoma also have granulomas. So I hope you understood this. So if you have any doubts, please put down your comments so that I can answer them with whatever I know. And please refer the other videos like the granuloma one and the foreign body giant cell. Both of them are quite important. And for the structure of blood vessel, please refer to the atherosclerosis video. I hope this was helpful. Thank you.